A rabies outbreak has been growing steadily in South Africa, and a worrying number of humans are contracting the disease, mostly from their unvaccinated dogs. As of today, there are 14 confirmed cases, a 100% increase since last year. Rabies, one of the deadliest diseases on earth, with a fatality rate of 99.9%. The National Institute for Communicable Diseases cautions that we should not think of rabies as a rural problem. It's everyone's problem. Let's find out more about this outbreak and what to do if we're exposed. Dr. Jacqueline Weyer is a leading medical scientist with the NICD. Dr. Weyer, first, let me just confirm that the numbers have remained the same since we got the release from the NICD last week?
Unfortunately not. Those numbers are from November. So as of this morning, we report 19 confirmed cases. 9 of these cases from the Eastern Cape, 6 of these cases from KwaZulu-Natal, and 4 of these cases from Limpopo province.
What's causing this uptick, Doctor? It's quite worrying considering how fatal this disease is.
Yes, so this disease is nearly 100% fatal. So the cases that we report are indeed fatal cases. The human cases are related to outbreaks of rabies in dogs in the affected provinces. Actually nearly all human cases in South Africa are associated with dog exposure. So when we see more rabies in dogs, there's a higher risk for humans being exposed to the virus, and then we also consequently see more cases as well.
So what do you do if you suspect you've been bitten by a rabid dog?
You would probably know if you've been bitten by a rabid dog. Yeah, you would know. A bite or even any other wound, it could be smaller wounds as well, scratches from an animal that's acting strangely. Rabies affects these animals as well, so they will be in ill health. You need to seek rabies post-exposure prophylaxis from a healthcare facility as a matter of urgency. So although rabies disease is fatal and we cannot treat the disease, we can effectively prevent the infection. And that's what we need to share with our communities. Access healthcare through your clinics or hospitals for rabies post-exposure prophylaxis.
You say you will know definitely if you're bitten by a rabid dog. So easy to spot an animal that has been infected by rabies?
It can be tricky, but these animals are ill, so they will look unhealthy. They will probably be acting really strangely. Often rabid dogs will become really very aggressive. Attacks can be unprovoked. So certainly, you would know if you were bitten by a rabid animal.
Once you are bitten, how long do you have to take treatment?
It's difficult to say. The incubation period for the virus varies, but what we can say is that it's urgent that you seek medical intervention as quickly as possible. The sooner you can get the vaccination and the treatment to prevent the infection, the better.
All right, Doctor, thank you so much for your time, and hopefully that information spreads far and wide. Dr. Jacqueline Weyer of the National Institute of Communicable Diseases.